Welcome to this video about urethral schistosomiasis, a parasitic disease affecting the urinary system. We'll explore its causes, how it damages the body, its prevalence, the symptoms it causes, how it's diagnosed, treated, and prevented. Understanding this disease is crucial for effective public health strategies in endemic regions. Urethral schistosomiasis is primarily caused by infection with parasitic worms belonging to the genus Schistosoma, most commonly Schistosoma hamatobium. These worms live in freshwater snails for part of their life cycle. Humans become infected when they come into contact with water contaminated with the infective larval form of the parasite, known as cercaria. These cercaria penetrate the skin and migrate through the bloodstream to the liver, where they mature into adult worms. The adult worms then migrate to the blood vessels surrounding the bladder and other parts of the pelvic region, including the urethra. Once in the blood vessels surrounding the bladder and urethra, the adult female worms lay eggs. Many of these eggs are excreted in the urine, completing the parasite's life cycle and allowing it to infect new hosts. However, a significant number of eggs become trapped in the tissues of the bladder and urethra. These trapped eggs incite a strong inflammatory response from the body's immune system. This inflammation leads to tissue damage, scarring, and the formation of granulomas, which are masses of immune cells. Over time, these granulomas can obstruct the flow of urine, leading to complications like hydronephrosis, a swelling of the kidney due to urine build-up, and an increased risk of bladder cancer. The constant irritation and inflammation also contribute to the various symptoms associated with the disease. Urethral schistosomiasis is predominantly found in tropical and subtropical regions, particularly in Africa, the Middle East, and parts of Asia. Its prevalence is closely linked to poor sanitation, inadequate access to clean water, and activities that involve frequent contact with contaminated freshwater sources, such as swimming, bathing, and washing clothes. Children are particularly vulnerable to infection due to their increased exposure to contaminated water during play and daily activities. The distribution of the disease is also influenced by the presence of specific freshwater snails that serve as intermediate hosts for the parasite. The signs and symptoms of urethral schistosomiasis can vary depending on the severity and duration of the infection. Early symptoms may include a skin rash or itching at the site of cercarial penetration. As the infection progresses, common symptoms include hematuria, which is blood in the urine. Dysuria, or painful urination, is also frequently reported. Other symptoms can include frequent urination, abdominal pain, and in severe cases, kidney damage. Chronic infections can lead to complications like bladder fibrosis, hydronephrosis, and an increased risk of bladder cancer. In children, chronic schistosomiasis can also impair growth and cognitive development. Diagnosis of urethral schistosomiasis typically involves identifying Schistosoma hamatobium eggs in urine samples. Microscopic examination of urine sediment is the most common diagnostic method. However, the sensitivity of this method can be limited, especially in cases with low egg counts. Other diagnostic tools include urine filtration techniques to concentrate the eggs and serological tests to detect antibodies against the parasite in the blood. Imaging techniques like ultrasound and cystoscopy may be used to assess the extent of bladder and urethral damage in chronic cases. Newer diagnostic approaches such as PCR-based assays are also being developed to improve the sensitivity and specificity of diagnosis. While urethral schistosomiasis is primarily caused by Schistosoma hamatobium, the severity and manifestations of the disease can vary. Infections can be classified based on the stage of the disease, ranging from acute infection to chronic infection. The severity of the disease is also categorized based on the extent of bladder and urethral involvement, the presence of complications like hydronephrosis, and the impact on kidney function. Detailed staging systems are used in research settings to assess the effectiveness of treatment and to monitor disease progression. The primary treatment for urethral schistosomiasis is the medication praziquantel. Praziquantel is highly effective at killing the adult worms. The usual dosage is typically administered as a single dose. Side effects are generally mild and transient, including nausea, abdominal pain, and dizziness. In addition to praziquantel, management strategies may involve addressing complications such as urinary tract infections and hydronephrosis. In severe cases, surgery may be required to relieve urinary obstruction. Regular follow-up is important to monitor treatment response and to detect any recurrence of infection. Prevention of urethral schistosomiasis focuses on reducing contact with contaminated water and improving sanitation. Public health campaigns play a crucial role in educating communities about the risks of schistosomiasis and promoting safe water practices. Access to clean water for drinking, bathing, and washing is essential. Improved sanitation facilities, such as latrines, can prevent the contamination of freshwater sources with human waste. In endemic areas, mass drug administration programs with praziquantel are often implemented to reduce the burden of infection in the population. Snail control measures, such as the use of molluscicides, can also help to reduce the population of the intermediate host. The prognosis for urethral schistosomiasis is generally good with prompt and effective treatment. However, chronic infections can lead to irreversible damage to the bladder and kidneys. Regular monitoring and treatment can help to prevent serious complications. Recent research has focused on developing new diagnostic tools, vaccines, and treatment strategies for schistosomiasis. Genome sequencing and other molecular techniques are being used to identify new drug targets and to understand the parasite's biology. There is ongoing research into the development of a schistosomiasis vaccine, which could provide long-term protection against infection. The WHO is committed to controlling and eliminating schistosomiasis as a public health problem, aiming to reduce the global burden of this debilitating disease.